We are a mid-size institution that has undergraduates, graduates, doctoral programs, medicine, and law. And it is just right for interprofessional healthcare education because of all of those entities. We have a school of nursing, we have a school of public health, and we have a school of health sciences that has OTPTPA. It has respiratory radiology, health science studies, and we partner with other universities that don't have majors that have majors we don't have. Emerson College for speech, Southern Connecticut for therapeutic recreation, and counseling and athletic training. Brown University for their global public health. So we try to do programs either in person or on Zoom that really include a variety of healthcare providers. In addition, we do have business faculty and students that join our programs. So I'll talk about the structure and the functions, and then I'll tell you a little bit about our ability endeavors that we try to embed. So the structure of the center is that there's myself, who's a full-time director. I do have to teach one course a semester, including the summer, but those courses are either in ability or they are in interprofessional healthcare. So it's part of my job. There is a half-time assistant director who teaches 2 courses in the fall, 2 courses in the spring, and then helps with programs. What is our powerhouse, however, is not us two. It is our executive planning committee. It's made up of 25 faculty representing all the healthcare related programs on the university campus. These faculty are given service and workload time in order to be on this committee. They develop the curriculum, they pilot it, they collect the data, do the analysis, revamp, and then they go out and share their work through dissemination. We've had about a half a dozen articles accepted in MedEd Portal. This month is pretty busy in IPE because Thomas Jefferson Conference on the East Coast. We have 9 presentations there. The Allied Health Conference is going to be next week or in 2 weeks in Florida. We have 4 presentations there. And we have 5 pending book chapters. So one of my jobs as the director is to help the faculty on this executive committee not only do service, but to get IRBs and then pull them forward with data collection all the way to dissemination. And I think we're pretty proud of our accomplishments there. Our operating budget, I can't tell you the financials, but our programs are 50% funded by the dean and 50% I have to fundraise. So I do not fundraise on non-renewable grants. I only use grants that can be renewable up to 5 years for sustainability purposes. And then I get farmed out by contract to other places to do presentations or consultation. So if I can bring in more money this year, then the dean will match it dollar for dollar. So that's a pretty cool thing from the standpoint that I'm pretty sure what my operating budget will be at the basic. And then I can always fundraise beyond that. We have several grateful alum that have given us money for some of our programs. And we have an endowed program where somebody gave $500,000 to the university, and I get to reap the interest income every year off of that $500,000 to do programs which will educate students to work together as a team for people who are in end-of-life care. So that's our structure. Try to keep it simple. Of course, we're a private institution. They'd like me to raise more money. They'd like me to speak publicly more often. I'm 70 years old and I'm getting a little tired. That's the MO of being a private university that does not have a huge endowment. But many of you probably face the same exact scenario. Our functions. So in any given year, our IP Center offers 45 different seminars to students. They are in the evening, some are on Zoom, most of them are face-to-face, and students register for the number of hours they need for their curriculum. So I'll be concrete. School of Medicine requires all medical students to do 6 hours of IPE every year. And half of them can be in the fall, half of them can be in the spring, or all at once. The School of Nursing, it ramps it up a bit. So kudos to nursing. They require their students to do 15 hours a year in IP seminars. So we offer these seminars fall and spring, and in any given year, we have about 5,200 students that attend these seminars. The seminar curriculum are developed by our executive committee, and they must include diversity, equity, inclusion, and justice elements in each scenario. And in each seminar or scenario, they must include 2 elements of active engagement as recommended by AAC&U. So that can be simulation, either high fidelity simulation, mannequin simulation, or we can have standardized patients, people that are hired by the university to act out a healthcare scenario, or expert patients. Expert patients are people who the university hires to not act out, but to relay certain information about their healthcare journey so that students can conduct interviews, examinations, or other learning activities. So for example, since you're interested in people that have intellectual challenges, those individuals with parent permission from 18 to 22 and on their own after 22 can be hired as an expert patient. And they get $22 an hour, and they come in and they do some scenarios. They act themselves. So they may serve as doing a primary care interview where they go into an exam room, a team of students go in, for example, nursing and physical therapy, and they talk to the individual with an intellectual challenge and ask them primary care questions and design an intervention plan and show that individual that plan. Expert patients are so powerful because they have the voice of the person. They can be genuine, they are authentic, and they throw us curveballs without us even predicting it. We had a young man who was 21, was doing an interview because he had a knee injury. So he was doing this interview between nursing and PT. And at the end of the interview and the explanation for the exercise program, he asked the PT out on a date. Genuine on his part, genuine. The PT couldn't get a word out. She was so she just couldn't, she didn't know how to respond. And of course, there's video cameras in the room, and there's supervisors out there, and there's the emergency button if they need some help. But he was very good, and he said, well, you know, one of my life goals is to go out on a date, and you are very friendly, so I'm asking you on a date. That authenticity is something that our students really don't get that very often. So they worked it out. Everybody did well. And we sent him to some services in our social work department to help get him more involved in Best Buddies in the state, where hopefully he can ask somebody out on a date. So over 5,000 students participate in these seminars with these authentic expert patients, standardized patients, high fidelity simulation, or simulation. Another aspect of our function is that we have 6 undergraduate IPE courses. These courses are provided because some of the programs at Quinnipiac want their students to actually take an actual course for course credit as part of their graduation requirements that are based upon the IPEC standards. Those 6 courses are really very different. We have a course on adaptive recreation and sports, where students go into the community, bless you, and they work with individuals with intellectual and developmental challenges to prepare them to participate in adaptive sports. Our specialty at Quinnipiac, no surprise, is ice hockey. And because we won the championship last year, finally. So all of these individuals are taught and have the experience of ice hockey or sled hockey at Quinnipiac. We have a course where the students, the Quinnipiac students, the people who are in degree programs, can learn about art as a tool for health, where they learn about working together as a team to look at art as an element in their intervention plans for holistic healthcare. That's incredibly popular for our nursing students and our public health students. We have a variety of other courses that are more theoretical based, and students can also take a capstone research course in interprofessional healthcare education. That seems to be incredibly popular. There's usually a waiting list every semester for that course. I don't know if they think it's going to be wimpy, and then they get my name attached to them, and then they know they're in deep trouble. So we have these seminars, we have undergraduate courses, and then we have a poster day every year where students in health can submit their capstones, their literature reviews, their work. And it goes through a review process, just like a conference, and they get accepted, they get rejected. Acceptance and rejected is based upon their person first terminology and linguistic use of person first philosophies and bias-free language as documented in the APA and AMA and ABA manuals. So it's a way that we can get students to look at person first work in their IRBs as well as in their presentations. Last year we had 425 posters. They were done with more than one student, giving us about 600 students participated in it, and very successful. Every poster has a QR code on it, and anybody who passes by can do that QR code and give direct feedback to the presenters. Our IPE Center also has as its function to provide 3 faculty development programs every year, and one must be open to people in the community, and 2 are internally to Quinnipiac. So, for example, our faculty development program for the fall will be on how working together as an interprofessional team can increase quality of healthcare and inclusivity, and that will be done by Peter Kahn at Harvard. No, I'm MGH now. He's at MGH now. I better not make that mistake when he comes. Our spring program will be on inclusion for all in healthcare, and we will be having the director of the documentary. The Color of Care was done by Oprah Winfrey's organization. If you haven't seen Color of Care, it has great educational value for everyone to look at. It is a whole bunch of stories from people that are Black and brown, and how they were not provided the same quality of care during COVID as their white counterparts. City by city, hospital by hospital, primary care by primary care. There are stories of people with intellectual disabilities in that documentary as well. Our external program is usually in the dead of winter in Connecticut. And so there's no leaves on the tree and there's ice on the ground. It's usually in February or early March. And we have a best practice summit for interprofessional healthcare. It is a one-day educational summit where faculty, usually from New England and New Jersey and New York, who are interested in learning about best practices, how to write curriculum, how to educate standardized patients, come and we share best practices. We usually have guest speakers from Nexus, from local organizations. And our other big function is micro-credentials. You know, the little badges people put in their names in their signature page. We have 2 micro-credentials at Quinnipiac for our students. They are free to students, so it gives value added to their education. One is on relational leadership, where students study with a team of 5 faculty for a total of 40 hours with a culminating experience or project, and they get a digital badge. They get it also put on their transcript. And the digital badge organization that Quinnipiac uses is Credly, which is a wonderful, very easy system to use, great people to work with. I do not know how much it costs to be a member of Credly. I asked, but nobody was willing to tell me. Our second micro-credential is in interprofessional healthcare collaboration. This is where students must spend 60 hours with other people in community-based interprofessional learning activities. They may do work with people that have intellectual challenges. They may help to run my high school program. They may work in the community with the Legacy program, which is a great interviewing, narrative medicine interviewing technique that allows people to capture an individual's interpretation of their legacy as they have advanced dementia or end-of-life healthcare conditions. Those are all captured in a Shutterfly book that we give to the patient. Our ability programs are fun. I am the director of 2 high school programs we have here at Quinnipiac. And these are for people that might have an intellectual or developmental challenge by their IEP in their high school. And these 2 programs, they can come to Quinnipiac. We collect a small tuition, and they're involved in programming that's designed by our team and executed by interprofessional teams of students. It's a bear to organize. It is, but once it's up and rolling, it is so beneficial that we have a wait list of Quinnipiac students who want to do that. So we have a high school called Bridge to Life. These are individuals that in their transition plan in their schools have indicated that they want to go to work and live independently. They come to Quinnipiac Monday through Friday from 8 until 2 for 12 months for 3 years. And we have 100% employment and 100% placement in different residential facilities in Connecticut, which are all semi or completely independent. That program has about 20 students in it each year. And the programs, I said, are run by students in an interprofessional team. So lunchtime, it's about nutrition. So we have nursing and PA and nutrition students who come in every day at lunchtime, and they talk about how do you pick out the best food in the cafeteria? How do you prepare better snacks? How do you recycle food? How do you save it for dinner tonight? They go on shopping trips. They have meal prep, because I do have a kitchen attached to that high school. And they typically eat in the cafeteria with hundreds of other Quinnipiac students. And the IPE students at Quinnipiac run the programs all day long from 8 to 2. So work using public transportation, the whole 9 yards, so that they can work in a competitive salary and live in a system that has some type of supervision that's best for them. My other high school program is called College Life. These are students who in their high school have said they want to go to college, and they are taking college prep classes with modifications and accommodations. They come to Quinnipiac for just 1 year, and they take courses at Quinnipiac. And our students, the IP students at Quinnipiac, help them to understand how to read a syllabus, how to plan their work schedule for studying, how to buy books in the bookstore, how to eat in a cafeteria, how to go to the accommodation office and ask for accommodations, how to file a complaint about their student or about parking or about the cost of hummus, which is what we got last week. And these students don't have one-on-one individuals in their college classes, but they have these supports and peer mentors at the university. Our rate of success from those students going on to college is only about 72%, because after a year, a lot of these students say, you know what, I really don't want to do homework. I really want to go to college classes for the socialization. I really don't like going into business just because mom and dad were in business. It's not for me. I want to go and get a certificate at a technical school in welding. So the College Life program is the same type of phenomena where students at Quinnipiac in interprofessional teams design the programs and work them through. They have supervision and critique after the fact. So that is it in a nutshell. I think that's a very big nutshell. Our program started in 2016. So we are not yet 10 years into it. And it's a win-win for the university, for the students, and for people in our community that have any kind of a challenge, or even individuals who are going into the healthcare system and want to be a good consumer of healthcare. That legacy program that I told you about is fully funded by a grateful alum. It was a small program, and this woman was in our program, and she did pass away from advanced dementia. Her husband was so thrilled with the program. He is an alum of Quinnipiac that he endowed it so that I get interest income off of that project to cover stipends for faculty supervisors and the Shutterfly books. And in the community, we have individuals that have rare diseases, people that have advanced dementia. We have people that have Lou Gehrig's. We have people that have advanced rapid cancers that are involved in the program. And we service probably 60 people in the community each semester, where our students at Quinnipiac go to them with a supervisor, social work, OT, and they do these narrative medicine interviews and create a pictorial legacy book for each person. It's been a great learning experience for everyone. Sometimes the patient does pass away in the middle of the process, which has been, we have a bereavement program through our social work department for our students if that happens. In many of the circumstances, our students are invited when the person does pass away to do a presentation at their celebration of life, where our students go in and do some type of memorialization of that individual in a eulogy format. So it is a sensitive project. We often have a wait list for that. I could double it in a minute with the number of students and people from the community that would like to be involved. Our program does the supervision of our Best Buddies program at the university, and I also supervise the autism awareness group at Quinnipiac as part of my workload. So I'll stop now and ask you, what questions do you have?